Good evening and welcome to the Board of Health meeting, Tuesday, September 7th, 2021. We're going to skip ahead and go right to some of the action items. We'll circle back to...
No, we have an appointment at 5 o'clock first.
Start with Bob first and then go to the action items.
Why don't I see the appointment? Oh, way up top. I apologize. Okay. So we do have an appointment. So Bob Bucher, who is our contractor, one of our contractors for Title V.
Our only contractor.
Okay. Bob, come on up.
Hi.
Hi, good afternoon.
Good afternoon.
So I had asked Bob to come in to kind of give, well, first of all, I don't think he's formally met the board yet. He's been working with us since April, but to kind of give you an update on how it's been going with him and what's been going on and see if you had any questions for him.
Just first of all, thank you, for stepping up and helping us in time of need. And we're close, but we're still trying to figure out what the dynamics and what the office is going to look like and positions and things like that. So we're close to finalizing that. But again, I know that you've been a tremendous help to Sue and a great asset to the town. So again, thank you very much.
I appreciate that. Thank you for the opportunity.
Now, I have one question. So looking at the invoices for for August. So is this an average month, or was, and again, I'm not talking about the dollar amount, it's just the number of inspections and plan reviews? Like in your opinion, as far as history goes? And
So June, July, and August are typically the busiest seasons for Title V activities in the municipal health department. As far as average for East Bridgewater, I can't say because I think I only operated here in May, June, and
Right.
July.
Okay.
But it's in my experience in the 15 years or so I've been doing this, it's fairly average, about what I'd expect for a town this size.
Okay. Has there been any challenges or anything where we've stubbed our toe that we could do anything better or quicker, faster?
Not that I can see. It's been a great fit.
It appears to be. I don't.
Yeah, well,
I
I'm very familiar with a lot of the engineers and installers in this area. They're familiar with me.
Right.
Sue and I have a great working relationship. So, no, I like I said, I think it's been a
It
very
appears
good
that
fit.
way, and that's a compliment to Sue as well, because I know that she's going to work with a large amount of different folks, but from what I've seen in the short period of time, it's been almost seamless. So again,
And that was the intent, and yeah, I feel like we've met that objective quite well.
great. Well, again, that's thank you to both. What else?
Do you foresee this relationship between the Board of Health and the town and you being able to continue for the foreseeable future?
Yes, I do.
Okay.
Like I said, it's been a very good fit. It's very much what I was looking for when I formed my LLC as a contractor. So yes, in the foreseeable future, definitely. Given the people that like I said, the installers and engineers, the fact that Sue and I work very well together, I absolutely think it's a good situation. I'm located right in Middleborough. My children actually live closer to here than I do in Middleborough. They live with my ex-wife on the Brockton East Bridgewater line.
So how large of an operation is it? Just you? 'Cause I know your card said and sons. I don't know. Are any of your kids in the business yet?
No, so
not
the
yet?
and sons. So I actually started doing Title V inspections privately back in 2008, and I started as Bucher and Sons Title V Services. And when I decided to go out on my own, I rebranded to Bucher and Sons Clean Community Services, and it's really just because I have 4 sons.
Just sure, you gotta have a family.
They're my highest priority. So
Yep.
that's the and sons. If you look at my card, the 4 trees, there's 5. I'm the tall tree, and the four other trees
cool.
are my sons.
Are there any other services that you offer that may fit that we could use? 'Cause right now, we're only doing Title V
Sure.
and stuff.
Yeah, well, I mean, I think that's probably one of my strengths is that I'm fully capable in the realm of public health. I'm an RS, I'm a certified health officer, soil evaluator, system inspector, pool operator, serve safe, first responder. I mean, you know, it's a vast position for anyone to fill, but fortunately, given the way Sue and I tend to work together, I think absolutely if, you know, if she called upon me to assist her in any other way, and I was able to, I'd be happy to.
I know our contract.
I like Title V, that's
Yeah.
my niche, that's
Like
my
about-
industry niche, but I'm capable of assisting.
So I know our contract with you has rates set for different Title V and septic issues. Do you have other rates for other things that we may have to use?
I don't have them set in stone right now, but I always aim to make it mutually beneficial to myself and any municipality or other entity that I would be dealing with, so I'd certainly be open to discussing it,
Okay.
like I said, in a way that would be mutually beneficial.
And I did try to get him to apply for the job, but he likes being self-employed.
I understand. What else?
I'm good. I've met Bob before.
Just wanted to kind of let you know, so just for you, so you know how it kind of works in our office. So he set aside Tuesdays and Thursdays as EB days in full. So I get a perk test application. I know I can automatically set it up for a Tuesday or Thursday, and he can do several a day, depending on, like today he had a little bit of a longer one, so he let me know. That might take a while, so don't book extra stuff. But in general, you know, I've booked this one day, I think we did 3 in a day. And other days it's just 1 or 2. So Tuesdays and Thursdays, I know, unless for some reason he lets me know he's gonna be on vacation or out of town, it's East Bridgewater. So when an engineer sends up a perk test, I just schedule it and send him a copy of the schedule, and that's it, it's easy peasy. And then he's also in town those days for any inspections, and people are starting to get the handle on that now, like they know every Tuesday and Thursday he's in town, so they try to line up all their work to do inspections that day. But if he's around, and he has come out several times on Monday, Wednesday, and Friday to do a final inspection or an open hole, as long as he's not busy doing something else, he'll swing through and do that too. So we try to keep it to Tuesdays and Thursdays, but, you know, it works out pretty good, and mostly, and he emails the office a picture of every single inspection he does, and then it's also in the calendar, so when somebody finishes a septic system, I can search the address in the calendar, and I can see, yep, they had their open hole, they had their final, Bob sent me pictures of both, they're good. So it seems to be working out pretty well. The 1 week that I tried to take a vacation, I did leave his number on the voicemail. I don't think you got any direct calls. And when somebody has tried to call him directly, because they think that's just an easier thing to do, he'll say to them, you know, go through the office, because they track in all the inspections. So people are kind of getting into the routine, so it seems to be working well, and they seem to be getting it. And actually, we're getting a lot of perk tests done in a short time because of the availability, because that's all he's doing, you know,
Right.
so it works out pretty good.
One thing I did see that I liked to help me coming on, you know, brand new, not having any industry experience, was your check sheet. we didn't really have a check sheet or, you know, something of that nature, and it was pretty clear just going down, you know, what you did, and what you're looking for, and all that. So that was a.
I give them a copy of, so tonight in front of them for the agenda, they have a copy of your sheet for the 2 plans that you reviewed. that you
Okay.
fill out.
Yeah, I try to make notes too of the things that would stand out, that I feel like are most notable. I normally put those on the top of page 1. But certainly, I'm also available to any questions, or, you know, I've functioned in health departments with city governments, small town governments, in various locations throughout the state, so I have a pretty good handle on the industry, so if you ever have any questions, feel free to shoot me an email.
I may
Sure,
have
sure,
to
absolutely.
utilize that. I
Yeah.
didn't want to bug you, but every once in a while there are questions like, oh my God, I've got to look it up or make a phone call. So do you do this for other towns as well, or is it mainly there at the level?
Well, I'm reviewing plans for the town of Halifax. I do perk tests for Mattapoisett, and Freetown has reached out to me about potentially doing some food inspections when they fall short, just to help out, but I've yet to do any activities there.
Gotcha.
But so East Bridgewater has been the best fit and certainly the brunt of my municipal work.
I think that's all I have.
Yep.
Sue, all set?
Nope, I just thought it would be good for you guys to put a face to the name,
Yep,
ask any
absolutely.
Do
questions.
you have anything for us?
No, not necessarily, other than certainly do not hesitate to use my phone number or email if you have any questions, or if you ever want me to come in.
I do
meeting-
want to go out on a couple of tours. I haven't been able to free up some time, to go out and take a look at what actually is the process, whether it's the perk or sign it off on the whole, or any
Sure.
of that. So I would like to
Yeah.
do kind of a ride along.
I'm like a Title V geek, you know.
So those are, just, I have no industry experience there whatsoever, so it's just something.
Understand.
Both the other folks here have healthcare, and we have a first responder and nurse, and then I have not, other than what Sue's been able to teach me in a short period of time. And then these folks about COVID,
Yeah.
zero industry experience.
It's vast, you know.
Yeah, well, every time I click in, there's another thing that you just keep getting deeper and deeper and deeper. It's like, okay, I gotta clear my head here, so just a cursory overview is what I'm looking for.
Absolutely.
But that's all I have. I don't want to take up any more of your time. But again, just a huge thank you to both of you, because it's seamless to us, or at least it's seamless to me, because nothing's filtered up to us, or at least to me, that there's a challenge. It's just been chugging along. So that's the way it should operate.
I feel like the timing was right for, for the town and me. For your,
Good, good.
it happened to work out nicely.
Excellent. A rare win-win-win. Okay. All right. Well, thank you very much. I really
Very nice to
Thank
meet
you.
you all. Have a great
coming in and all
evening.
that. All right. Enjoy the
Thanks,
night.
Bob.
Talk to you.
All right, so now you want to go down to the action items?
All right. Okay, so now we'll skip ahead to some of the action items. Disposal work permits. We have 2, 8 Hudson Place and 369 West Union Street.
Yep, and those are both in your packets
Yep.
of stuff, yep?
Okay. So I'll entertain a motion to approve the 2 permits.
Motion?
Motion Lisa,
Seconded?
second Matt. All in favor?
Aye.
Aye.
Okay, passed unanimously. Then we have invoices, Bob Bucher, Robert Casper, and Crystal Rock. Crystal Rock being the water,
Water,
correct?
yeah.
Yep. And we just talked to Bob about his. And again, just trying to get a handle on what, is 3,025 an average? Is it?
So I think that if we look back to the month, maybe it was last month, July, it was a similar
right.
for the whole month, yeah.
And that makes sense, June, July, August.
Yeah.
I'm sure it's
In the
gonna
winter,
slow
it gets
down,
quiet,
right,
obviously, yeah.
Picks up, so we do at some point in time want to get a little bit closer handle on what that yearly is going to be approximately. So we have Bucher and Sons there.
I just had a quick question
Yeah,
on
go ahead.
Beaver and Sons. So the perk test that was a no-show by the engineer, does the engineer assume that cost?
Yes.
He does.
Yes.
It's,
Okay, so,
Second
right, but
page,
so, I'm sorry,
85
your
feet
answer
lane.
was?
Yes, yeah,
They
we
do
charge
assume-
them a
right,
fee, and
okay.
we also had another one, it's the old F1 Raceway, they
Mm-hmm.
did a perks one day, they were out there for a few hours and wanted to come back a second day, so I had them submit a second check to cover, because I said, I've got to pay someone to go out, so you're going to have to pay us to go
Mm-hmm.
back out, so they did do that.
And then, while we're talking about bills, and especially both the food service and Title V, we, as a board, should probably, with your help, do a review of our fee structure to make sure that we're charging appropriately,
Yeah.
so that the town or us is not upside down.
Yeah,
So
so
that's-
we did do our fees about a year and a half ago, we compared them to all of our surrounding towns. So the food service was actually upped, I think it was upped by $25 for a full-time one, and it was doubled for some of the seasonal stuff just about a year and a half ago. The perks went up about a year and a half ago. So we did do a pretty thorough analysis. We did, pretty much the entire South Shore and brought some of the things we were already high on, but some of the things we had to bring up.
As long as at the end of the day, we come out
Yep.
to, net zero.
We should.
It's not a revenue stream, but it's certainly not a way
Right.
for us to lose money. Okay, so with these 3 invoices, any other questions on
No, thank you.
that?
Nope.
Okay, so I'll make a motion to accept the 3 invoices from, okay, second Matt, any discussions? Hearing none, all in favor, say aye.
Aye.
Aye, so that passed unanimously. Installer permit, so we have 1.
I'm not sure if they're in order or not. I had Nancy helped me with all that this morning.
Yeah, they don't know. Redland?
Yeah.
So on the, on invoices.
Yep.
There's Massachusetts Health Officers
Oh,
Association.
I'm sorry, yes, that got added in, I apologize.
That's right.
That just came in,
Okay,
so we're gonna do that separately then.
so is this at the person level or at the board level?
The board.
Okay, so all the
So
board
the office,
members.
so basically, so it's the East Bridgewater Board of Health. So it gives us, so now we'll start getting notifications of different things happening within, before I wasn't getting any notifications of training or classes or, so once we pay that bill, we'll get notifications of some of the things going on that will be available to us.
Okay, so this is something that we had kind of
We
done
had,
away from a little bit?
we had it, it's been several years since we've been.
Okay,
since
but
we've
it's-
been-
it's-
yeah. Yeah.
Well worth the $60.
Is it something that we just stopped doing for a reason? Just
I don't know the answer to that. It was, I wasn't the active member, so I'm not sure of that.
Okay.
So, I will make a motion that we accept and pay the invoice for MHOA.
Second?
Second, any discussions? Okay, hearing none. All in favor?
Aye.
Aye, so that passes. So what's the membership timeframe? Is
It's
it rolling?
annual. It's yearly, yeah, so every year we'll have to renew it. It's probably,
But is it rolling, or do we have to do it again in January? Not that $60 is gonna break the bank, but
that's a good question, and I do
just,
not know the answer to that
if you've
yet.
come across it,
Yeah.
that's just in case anybody asks. Okay, so that's that.
What it also does is gives you early registration and discounts for different training sessions, so I think it's, definitely worth it to have
Yep,
it.
no, I agree. And then, so when you do start to get those notices?
Yep.
If you could pass them to
Yeah,
the
that's what I
board?
was planning
Okay,
on doing, yep.
Excellent. Okay, back to installer permits. GS Redland. Okay, that's Crystal, we paid that. That's West Union.
So that's a renewal.
Hmm? Okay. I'll entertain a motion to accept the installation permit or the renewal for GS Redland.
Motion?
Second?
Okay, motion Lisa, second Matt. Any discussion? Hearing none, all in favor?
Aye.
Aye, it passes. And then we have minutes from 8:19 and 8:20.
So we only have 8:19. I was not able to get to
Okay.
8:24.
All right, so I'll scratch that.
I think I emailed those out on Friday.
Mhm.
Yep. Motion to accept the minutes.
Motion?
Motion Lisa, second Matt. Any discussions? All in favor?
Aye.
Aye.
Aye, passes. Okay, so now we're gonna go up to discussions. So, you want to hit 30 Andrew Road first?
Sure. So I sent you all a copy of the letter from the mold remediator. So I did look them up online, they appear to exist. I did leave a voicemail, but did not get a call back, just for a confirmation that, somebody was out there. But Officer Garillo was actually petitioned by the landlord to be there when he went there, because he was concerned about, any problems. So
Dynamics.
Officer Grillo did verbally tell me that, yes, there was a mold person was there and went down the basement.
Okay.
So there was a person there. And so we do have this letter. So Mr. Savino was looking for something. So I, back it up, I went out Friday. I texted you all on Friday. I went out Friday. The building inspector came with me. We checked on those remaining items. The railings were installed. The fire detector, smoke detector, CO detector was installed. There's a new stove. It's not brand new, but it's a new, new
Sure.
to the thing, functioning
Works.
stove.
Works, we tested it.
Yeah,
If someone
so,
said,
and then we have the letter. So, the landlord, the tenant pointed out another problem that was not subject to this original order. There appears to be an air conditioning or something leaking down the side of the wall. It's causing some dampness in the kitchen. But that is not part of this order. And, the air conditioner was running, probably should have been shut off if the wall was wet. So, they shut it off.
Does the air conditioner belong to the unit?
So
or
that's
is
what
it
we
personal?
have to determine. It's built into the wall. So Patrick, the building inspector, seems to think that at Pompanoho Pines, things like that, things that are on the outside of the building or that are part of the structure are part of the condo association.
Right.
But regardless, that's a separate issue. Things got a little vocal between the two of them. Patrick and I were able to, get out and calm everyone down. So I will do something new to Mr. Svino about the wall, but the tenant did indicate on Friday that she was leaving that day.
Like moving out, leaving?
That's what she did verbally indicate. So I will make sure that he knows that before renting that out again,
Mhm.
that should be addressed. I mean, and he says he's gonna sell the unit anyway, so obviously he's gonna have to address it anyway, but we'll have something in writing just to say that, it was noted and needs to be repaired.
Okay.
And I don't know, and we'll send a copy to
Does it
Pompanoho.
fall under the housing code that,
The wet wall will, because it's a wet, it's now, you don't need to have air conditioning, okay, it's not required, but there was significant water damage to that wall area, so, that itself would, so. But it was not part of this original order that we were going up. So basically, he's looking for something to say that he complied with everything, but the order did say for the rug to be removed, so I told him that I would need to have the board review this letter and decide on whether or not they would accept that in lieu of, removing the rug. So, we have done it previously. We are not mold specialists. I couldn't tell you what's good mold, bad mold, if it's mold or mildew. So we really need to rely on specialists to help us with that stuff sometimes, so. It's a pretty detailed letter.
Well, if this is, not, if this is not up to snuff, Mr. Erickson here has put a lot of information, or Ekman has put a lot of information to make it look like he has.
Right.
So, and,
And like I said, I looked up the business. It goes under 2 different names, but it is there. Same phone number, same email,
Okay.
same everything, so.
okay. And like you said, everything else on the,
Yep, the railings were installed. They were just finishing up when we were there. We were trying to get there before noon to make sure we got it. Smoke detector worked. We tried it out. The stove worked. We sat and made sure that all the buttons worked on the stove. So,
So as follow-up, do we send out something to Mr. Savino saying we recognize that he completed his end of the repairs in a timely manner, or?
well, I wouldn't call it a timely manner, but we would, yeah.
Considering
Yeah.
a hearing and.
So I would probably, what I would probably do is rather than, I would probably take a copy of the old inspection report and indicate everything that it was completed and say that we'll, that we're gonna accept this, if you do vote to accept the letter. And that, this particular housing order is now closed and he's complied with it.
well, as difficult was at the meeting was, and, I can understand how we got here, but, we did set a date of September 3rd, and he did start to get in there before September 3rd.
He did, yeah, he went in like the next day with the.
So, You know, again, I wish the meeting went a little bit smoother, but regardless, I'm in favor of, sending him a letter saying that, yes, everything's completed, and then we will not be issuing any citations.
Okay.
So I'm gonna make that motion.
So, so you're comfortable with the letter, all three of
I
you?
am.
or-
Yes.
Well, we're gonna vote on it.
Okay.
So that's my motion, that we send Mr. Savino a letter of completion for the issues that were out of compliance, and we had a date of September 3rd, and that date was met. All the issues were resolved, and then we'll be waiving any fines that he may have accumulated in the period that, from the order to
Should
September
we
3rd.
vote on accepting or not accepting the letter first, so because that's part of that motion?
Sure, we can do that. We can, so why don't we do that first? So I'm gonna make a motion that we accept the letter from South Shore Cleaning and Restoration regarding the potential mold or lack thereof at 30 Andrew Road.
Second?
Okay, second, Lisa. Any discussions? Hearing none. All in favor, say aye.
Aye.
Aye. So that passes, so we'll accept the letter. So, so now the vote would be, the motion would be to send Mr. Savino a letter of completion regarding 30 Andrew Road with the prior list of items that were out of compliance that are now in compliant, and waive any fees that may be.
So we didn't actually, fees never began because he appealed it within the appeal period, and he completed it within the date we set. So I don't know if we want to say that per se, because that.
I thought we had either voted or agreed that night, that based off the meeting and the lack of what seemed to be cooperation at the time, that the fees would start to accumulate.
We didn't take an official vote that any fees would accumulate, because.
Okay.
I don't think,
as
and I don't
Sue
think
said,
we,
Appeal
and I think
process.
because he
Couldn't
met the
because he appealed
specific
it.
Yeah,
timelines,
there
even
was
though it
no
wasn't a
fees on the
smooth
table.
thing.
Then all we need to do is,
Yeah.
so the motion would be just to send
Yeah.
Mrs. Vino a letter concerning 30 Andrew Road, that all the items that, or the issues that were out of compliant have been brought into compliant.
And as okay, do you want to make a motion?
So that was my motion.
All right.
Second?
Okay, second, Lisa. Any discussions?
So to say, in a part of that letter, I think, what I'd like to do, as I mentioned to him verbally, is I'm going to suggest that prior to renting that unit or any other unit, he may want to request a pre-rental inspection, so that maybe we don't get into this again.
Yeah.
Can we talk about parental inspections, or do you want to talk about that in a separate?
Maybe we'll put it on another agenda, just so we can make sure the conservation gets their room in time. We can
Yes.
put that on an agenda.
Okay, we should talk about parental inspections across the board.
Yep.
But so just as a clarification, I don't think we should put that on his letter for this
Nope.
completed
Okay.
thing,
Yeah,
per se.
it would be a
That's fine.
separate issue
Only
or
because where there's
conversation.
legal litigation coming
Yeah.
forward, I don't want it to imply that
I
it
got you.
sways in one direction or another.
I got you.
Yep.
Yep.
Yep, I agree with that.
Not a problem. We can keep it sweet and simple.
Okay, so, motion Lyons, second Lisa. Any other discussion?
Just to clarify, the letter's gonna say you've completed the,
Yep, so I'm going to attach that report
Yep.
with everything checked off, as indicated on the attached report, all outstanding, we'll think of the wording, but everything's been if you're in compliance.
and we'll make no mention of pre-inspections.
Yep.
We'll make no mention of.
Nope,
any
just that's
fines,
it,
things,
sweet and
just that.
simple, yep.
Perfect.
And the copy will go to the tenant as
Do you
well.
have a form letter, is there a?
A form letter? No,
Yeah,
first
okay.
time we've
All right,
had,
fair
first,
enough.
this is a first.
Might be something to make up now.
Yeah, this is a first, yep.
Right, save it. Okay, any other discussion? Hearing none, all in favor?
Aye.
Aye, so that passes. Okay, so that takes care of that. Office updates?
So I just got a couple of quick things. We'll go down the COVID quick first. We had 55 cases in our last 2-week reporting period, which is About the same as we had in the previous 2 weeks, so we didn't see a big increase, but we didn't see a decrease either, and we've had 12 since the 1st of September, so into the first 7 days of September, we've had 12 cases, 3 of those school-age children. School is now rolling, so we did put that on Facebook today, reminding people, kids are sick, keep them home. If the kids have been identified as a close contact outside of school, keep them home. Excuse me, I need to take a sip of water. Karen Clifford is still the COVID director over at the school. They are very short nurses. They are down half their nursing staff. We've got an extended pregnancy leave. We've got someone that just has resigned and is leaving next week. So each school has 1 nurse instead of 2 this year, which they did pre-COVID, but last year during COVID they had 2. So as I sent you in an email, I think it was last week, they were not going to be doing the test and stay option because of staffing. When there was a little bit more clarification that the test and stay is strictly for kids exposed at school, and it probably wouldn't be that many kids if they were all wearing their masks. They've kind of warmed up to giving it a try, so we actually are doing our first test and stay option this week. So hopefully that goes smoothly and will work out and the nurses will not be overwhelmed. So the test and stay, again, for anyone listening, if your kid is exposed at school and is identified by the school as a contact, say like eating lunch or in gym class, and they have no symptoms, they can stay at school if they test negative every day for the first 7 days after exposure. So in the case we had today, the exposure occurred like 5 days ago, so they really only have 2 or 3 more days of testing.
Does that include weekends? Do they have to go out and get
So
a private
it
test?
includes weekends if they want to do any school-sanctioned activities on the weekends. If they're just staying home, they just have to test before they come back to school. But say you're on the high school football team.
Yep.
You want to play football on Sunday, and you were a close contact, you'd have to get yourself, not at the school, get yourself at like a rapid, it could be a rapid, test on
Well,
Sunday
yeah,
morning.
they sell the ones they do at school.
Yep, and then if you're
Yes.
negative, then you can go play football that day.
That's only if they're not vaccinated though, right?
Yes, exactly.
Because,
That's a
yeah,
good
if
clarification.
they're
This is for-
vaccinated, there is no
This is for
quarantine.
unvaccinated students, yes. Vaccinated, fully vaccinated students, if it's been 2 weeks since their last vaccine, do not have to quarantine. If they, obviously, unless they become ill.
Become symptomatic,
Yes.
yes.
Yeah, thank you. I'm glad you said that. So, yes, full, and so at the high school, obviously, we're gonna have more vaccinated kids then, like, we're not dealing with that at the middle and central school
Yeah.
yet. It's all unvaccinated. Same thing for teachers. Teachers can test and stay also if they're not vaccinated. So far, so good. Everything seems to be going pretty good at the school first 3 days in. And then at the other thing is COVID-related, is the library reached out to me. They're bringing their programs indoors. They're going to have kids' programs again, and they're a little apprehensive about the amount of people in the building, and they're looking for guidance. I explained that the state has not put out any specific guidance for any activity anymore. If they're that worried about the kids, they could follow some of the school guidance for indoor story time, treat it like it's a school program. But I did tell, the library isn't comfortable having any kind of policy for the library if the municipal buildings don't have a policy. So I said I would bring it to your attention for some thought. But I said, you could just kind of, say, please follow CDC and DPH guidance, which is unvaccinated people should wear a mask indoors. And if you follow the school protocol of keeping the kids 3 feet apart and having less kids in for the program, I think you're going to have less kids anyway, just because I think not as many people are probably going to sign up as they did pre-COVID, but
Is the library board an independent board?
I believe it is. And I said that, can your policy enact their own, your board enact its own policy, and I believe they can. They just didn't want to be the only town building doing that. But they're a little bit different than other town buildings. I mean, we're not having programs here. The COA is not getting that kind of foot traffic there. So really, they're kind of very different than any other building,
I mean,
so.
personally, I would think that unless the state steps back and sets some sort of guidance for indoor programs, that we would continue to follow that, and going beyond that for one municipal building where they have their own board is just making ourselves liable
Right.
for more.
Oh, yeah, no, I don't think we should have any kind of mandate. or
I
anything
mean,
like that.
it's a very simple fix. If they're
Yeah.
uncomfortable, they have a sign up and they limit it to a certain.
Right, well, that's what I said,
number of
just
people.
limit the people, maybe you can make sure you have enough physical room for like a 3-foot distancing. I said, if you kind of mimic what the schools, these kids are a lot of kids that will be in preschool the day before, and that it's a library program, so
Yeah.
you can kind of mimic it. But I said, your board, maybe they want to adopt a policy if they're concerned. But, I said I would let them know let the board know about his concern and see if they had any advice for him.
Do we know what the school's number is for the preschool reading program? You had mentioned that the school has their own.
They have a preschool, they have a regular preschool.
Right, didn't you say that, but they also had a number of,
No, I think she was referring to the kids that were enrolled in preschool would be the same
Okay.
populace
The same
that may
population, yeah,
attend the
yeah.
library.
So for instance, like my granddaughter was 3, she go to preschool Tuesday, Thursday, she go to story time
Gotcha.
Wednesday, you know,
Okay,
so it's a
so
lot
it's
of the
not a
same.
separate
No.
for any type of.
So anyone that wants to go, and I think you don't even have to live in East Bridgewater, I think
No, you don't.
anyone can go, so. I think,
Okay.
you know, you can go over to different libraries if you're.
Oh, the libraries, yes.
Yeah,
yes,
yeah.
yes. Okay, all right.
So I don't know if it's something, you know, you want to, just, I wanted to bring it to your attention that he's, you know, they've got some concerns, so I said I would do that tonight at the meeting. Flip it over to West Nile, you all got the email, so we got a call from DPH, I guess that was Friday morning, it was like right before I left on Friday, I think, that, you know, we had some West Nile mosquitoes in town, you know, they wanted to get the word out, so, because it was the holiday weekend, you know, people, just to remind people that it's here. We're not at that point where we're talking about any kind of curfew. The good news is, and I get a knock on something, we're not seeing triple E mosquitoes yet, which usually by now we're seeing some triple E mosquitoes.
Excuse me.
So that's good. So that, you know, the PR firm has just they have a kind of a form story they put out for, you know, just tips for avoiding mosquito bites. So that's what they kind of put out
So again,
for us.
was that a state or a county collection site?
Yes, that was the state. Well, so they work in conjunction with Plymouth County Mosquito Control.
Okay.
But I believe all the mosquitoes go to the state lab for testing. So they call us directly, so we'll get notified like via an email or a text if it's a surrounding town, but if it's our own town, they'll call us directly to make sure that we saw the email and got the information. And I think, and then I did have another housing inspection last week. A little bit smoother. So, but I did have to get the fire department involved. So I had a housing inspection on Central Street where the gas stove appeared to be malfunctioning, and when she put it on for me at the inspection, I could smell gas immediately throughout the apartment. So I said, I'm gonna have to call the fire department. So Lieutenant Olson did come out with, I forget his name. They did pick up readings while the stove was on, but as soon as the stove was off and the windows were open, the readings went down, so it showed that it was just the actual stove unit. So they red tagged the stove, which means that a licensed professional has to come in, inspect it, replace it, do whatever they have to do, and return the tag to the fire department. And, well, they also had an issue with the refrigerator. So I did hear from that landlord today that he had purchased a new stove and refrigerator, and they were set to be delivered and installed on Thursday. So that's going a little bit better. I think that's it.
Okay, under, and I'm just gonna throw this out there under office updates. I had mentioned this once before. I had tried to get a hold of somebody at New Epic, and I was able to get a hold of somebody on Friday. And I registered for Title V and soil evaluation for the fall. And if anybody else wants to do it, they'll squeak us in.
You got a soil evaluators class in the fall?
I start the 21st,
For Title V inspector or soil evaluator?
soil evaluator, and then the,
Because they just emailed me back that class was full.
well, I emailed, she was out on vacation. She had to sign out that she would be back on the 31st of August, played telephone tag. I spoke to her at length on Friday. She emailed me the information. I registered and sent it back.
So why are you registering for soil evaluator?
I have just like we were talking about with Bob, I have no knowledge of this whatsoever. So,
That's just shocking to me, because in the past, it's someone that's going to be an agent or an engineer, and there's a list a mile long of people trying to
you know,
get in.
if we didn't have, you know, some healthcare folks, in fact, I'm still probably gonna take a couple of healthcare classes in the fall, in the spring. But, you know, I did mention that I had sent her an email and a voicemail. She was back on the 31st, whatever, we played telephone tag, finally got a hold of her on Friday. So if anybody else wants to, it's an 8-week program, 2 days a week. It's, you know, I'm sure we can get somebody in. So I just wanted to bring that up and let folks know that the opportunity was there. And have you, I don't know if you've ever had any interaction with any of the folks that knew we picked this girl. I think her nickname's Shelley.
I've talked to a lot of people at New Pick.
Okay.
That's why I'm shocked, because I actually know 3 engineers that are trying to get in, they can't get in. So that's why I'm like totally shocked that you could get in.
Like I said, I just, explained
Been
the
on a waiting list for a
situations, that I was
while,
brand
yeah.
new, needed to get some self-knowledge. So, okay, so that's out there. And now I gotta figure out how to get to Acton. Health agent position. So we're gonna be.
That can go to executive session.
Yeah, so we'll slide that down. And I don't have anything else. Anyone? Okay, so at this time, like we've done in the past, we're gonna go into executive session to talk about candidates and talk about the health agent position. And then I will be asking for a roll call vote after I read the reasons why we're going into executive session. So, first we need to take a regular vote to close the open session. I'd entertain a motion to close the open session.
Like the motion.
Okay, that's a motion, Matt.
Second.
Second, Lisa. Any discussions? Hearing none, all in favor?
Aye.
Aye, so that passes unanimously. So at this point in time, we're going to open an executive session pursuant to Mass General Laws, Chapter 30A, subsection 21, paragraphs A, number 8, to consider or interview applicants for employment or appointment by the preliminary screening committee if the chair declares that an open meeting will have a detrimental effect in obtaining qualified applications, which the chair does. So we're going to have a roll call vote. Matt, how do you vote?
Yay.
Okay, Matt is yay. Lisa?
Yay.
And Rob Lyons, yay. So at this point in time, the executive session is now open. So we need okay, we have exited executive session, and we are now going to reopen the public meeting just briefly. And I don't even know if we have to, we've already closed the public, we've closed the executive.
I think we just have to vote on adjourning.
Yep.
Okay, so at this point in time, I'll entertain a motion to adjourn.
Motion?
Motion, Lisa. Second, Matt. Any discussions? Hearing none. All in favor, say aye.
Aye.
Aye. Okay, and we are adjourned for the Board of Health meeting, Tuesday, September 7th, 2021. Thank you, everybody.